just like last week, just like the week before, I'm here tonight to drag the government in here, to hold them to account, to ensure that they protect and enhance our public health care system and follow through with their promises. And Mr. Speaker, I'll just serve notice that I'll be dragging them back in here again next week if they don't take some action. Mr. Speaker, no one in Canada, not our kids, parents, or grandparents, should have to worry about the cost of medication they need to stay healthy. In fact, that's exactly what's happening today. Canadians were promised the beginning of a national pharmacare program. We actually voted on it, Mr. Speaker. A single-payer system that serves people, not a patchwork that leaves millions behind. And the promise was that we were going to start with universal free access to diabetes medicine and birth control. It was highly celebrated, Mr. Speaker, by the Liberals. Now, right now, only 3 provinces and 1 territory are covered. That's about 17% of Canadians. More than 4 out of 5 Canadians can't access the federal pharmacare plan today. 4 out of 5. That means access to life-saving diabetes medicine or birth control coverage depends on where you live or depends on your postal code. And while I hate to do this, Mr. Speaker, I must mention that this inaction comes while many Liberal MPs brag about the National Pharmacare program that their own constituents can't even access. In Newfoundland and Labrador, for example, the provincial health minister has said that the federal Liberal government has closed the door on negotiations. Meanwhile, the Liberal MP, for example, for Labrador, defends pharmacare as putting money back in Canadians' pockets. On Prince Edward Island, the federal government has moved slowly, and their provincial health minister says that the federal government's told them that pharmacare funds will expire in 2029 and they won't be renewed. Meanwhile, the member for Cardigan claimed that pharmacare is a key program for all Canadians. Nova Scotia is ready to negotiate, but it's still waiting for an invitation. Meanwhile, the member for Cumberland-Colchester described pharmacare as an essential service that Liberals will continue to protect. Their premier says he can't even get a meeting, Mr. Speaker, to negotiate a deal. These provinces want in, they're ready to work, but they're being shut out while these Liberals pat themselves on the back. That's not nation building. The Prime Minister was just on CBC 2 days ago, touting his commitment to pharmacare. Even today in question period, he rightly criticized the Conservatives for voting against pharmacare, but only 3 provinces and 1 territory actually have an agreement. Yesterday, the spring economic update, the word pharmacare is mentioned only once. It signals that the Liberals are walking away from their commitment to the National Pharmacare Plan they ran on during the last election. This has real consequences. People are skipping prescriptions, they're cutting pills in half, and they're choosing between paying rent and filling a prescription in a country as wealthy as Canada. That should never happen. That is not what Canadians were promised, like I said, in the last election. New Democrats in this House and across Canada are fighting to ensure Canadians can access the medicine they need, while the Liberals continue to delay and side with powerful industry interests. In BC, pharmacare coverage began on March 1st because the BC NDP government pushed for it, and the provincial health minister, Josie Osborne, acted quickly. She signed a deal. Families in BC are getting that relief, but families in the rest of the country are still waiting. And they're waiting because the federal government is refusing to negotiate. A truly national pharmacare program would guarantee the security Canadians need at a time of economic uncertainty. If the Liberals fail to meet their commitment, they're going to have to explain to Canadians why they're breaking yet another promise. So the question is simple. Will the government reopen negotiations with provinces like Newfoundland and Labrador and Nova Scotia? Will they commit to expanding pharmacare to every province and territory that wants in? Or will they continue down this path where access depends on your postal code or where you live? Canadians deserve better than this patchwork, Mr. Speaker.
The Honourable Parliamentary Secretary, the Minister of Health.
Thank you, Mr. Speaker. I want to thank my friend, the member for Courtenay-Alberni, for his question. He's been a long, strong advocate for better health outcome in his community and across Canada, and I'm really honored and fortunate to work with him in the House for the betterment of Canadian health outcomes. Those outcomes are possible thanks to our investments in healthcare, just as yesterday's spring economic statement was our government's next step in our plan to build a stronger, more independent and resilient Canada. We know that we're only stronger and more resilient if we have healthy Canadians, and that's something that I think everybody here agrees. That's why our government came to office with the pledge to protect existing pharmacare agreements. We know the role that they play in keeping Canadians healthy. In fact, starting last month, my colleagues' constituents in British Columbia are seeing the effects of their province's pharmacare agreements firsthand since it came into effect on March 1st. Thanks to this agreement, more Canadians have free and low-cost access to a range of contraceptives. Thanks to this agreement, Canadians living with diabetes can get essential life-saving drugs for their conditions. And thanks to this agreement, Mr. Speaker, Canadians are keeping more money in their pockets while improving their health outcomes. I know that the member opposite would like us to go full speed ahead, but recent years have taught us that we need to be mindful of the broader context, both within Canada and beyond our borders, as we make decisions. As we consider the changing fiscal environment, as we consider how policy decisions in other countries impact our pharmaceutical supply, as we consider what we hear from our provincial and territorial partners, all of these things matter. For our part, our government will continue to control what we can. That means working closely with our health partners, including provinces, territories, Indigenous people, to see how we can help them deliver healthcare for all Canadians. Because, as we have always said, we can build Canada strong without healthy Canadians. Thank you, Mr. Speaker.
Member for Courtenay-Alberni.
Mr. Speaker, I want to thank the member for coming in here. I know it's inconvenient, but I will continue to drag her and her government here to debate this issue, Mr. Speaker, because what we heard doesn't actually match the reality that Canadians are facing. Great to hear British Columbians are getting access to pharmacare, but the government says pharmacare is moving ahead, but only 4 out of 5 Canadians are actually accessing it. That's not progress, that's exclusion. They say it takes time, but provinces like Newfoundland and Labrador and Nova Scotia are ready now, and the federal government is refusing to negotiate. What we just heard the parliamentary secretary say, it's too expensive. But pharmacare actually saves money for families and for provinces. The real cost is forcing Canadians to go without the medicine they need. And let us be clear, mentioning pharmacare once in a major economic update is not a plan. It's a signal that this government is walking away from their promise. And it's not nation building, Mr. Speaker. Canadians were told this would be a national program, not a patchwork, not something determined by a postal code. No one in this country should have to choose between paying rent and filling a prescription. So the question remains, when will this government stop delaying, start negotiating, and deliver pharmacare for all Canadians?
Parliament Secretary.
Speaker, I want to make it very clear, is never an inconvenience. It's always an honor to come to this House and debate important issues. And I'm never dragged here because it's also my honor to debate important issues and work on behalf of all Canadians on the betterment of their health with the member opposite. Our government remains committed to building Canada strong by investing in healthy Canadians. That means protecting health pharmacare agreements that provide access to contraceptions and vital medications while also keeping more money in the pockets of Canadians. We'll continue to work with our partners on all sides, including the member opposite, to build a healthcare system that meets the needs of Canadians. Thank you, Mr. Speaker.